Good afternoon, everyone. This is Cindy Rogers from the Children's Safety Network at Education Development Center. I'm very pleased to welcome you to today's webinar, Preventing Child Abuse and Neglect to Create a World Where Every Child Can Thrive. Before we get started, my colleague Rebecca Wilmer will provide a few technical announcements for today's webinar. Rebecca?
All right. Thanks, Cindy. So there are two options to hear today's audio. You can either listen through your computer speakers or you can call into our phone line at 866-835-7973. If you are participating via phone, please mute your computer speakers to eliminate echo. Phone lines will be muted during the presentation to eliminate background noise. If you have questions or technical issues at any time, please type them into the Q&A box on the bottom left. After the presentation, we will pause for the presenters to answer your questions. We also have several resources available for downloading today above the slide deck. There's also a PDF of the slides in that file pod up there. And this webinar will be recorded and archived and sent out to all registrants after the session.
Okay, thank you, Rebecca. So today's speakers bring a wealth of experience and knowledge to our webinar. We're very lucky to have these national experts with us as we explore the complex problem of child abuse and neglect. Our first two presenters are both affiliated with the Division of Violence Prevention at the Centers for Disease Control and Prevention. Sandra Alexander is a recognized state and national leader, strategic thinker, and innovator in child abuse prevention with over 40 years' experience in the public and private sectors. She has provided training and technical assistance on child and family services spanning primary prevention to tertiary prevention, child abuse prevention, and consultation. For the past 10 years, Sandra has been an expert consultant in child maltreatment prevention at the CDC. Currently, she co-leads the division's Essentials for Childhood initiative, chairs the Cross-Branch Essentials Committee, and is a leader in engaging the business sector and other key partners in prevention. As a medical epidemiologist, Joanne Clevens provides technical assistance to colleagues, programs, and grantees on a range of issues including research methodology, evaluation, prevention of child maltreatment, sexual violence, partner violence, and youth violence, and addressing social determinants of health. Joanne is particularly interested in how policy changes influence rates of violence. During her 15-year career at the CDC, Dr. Clevens has conducted or collaborated in numerous violence-related research projects. Currently, she leads the evaluation of Essentials for Childhood and the division's efforts to tackle social determinants of health. Now I'll pass the microphone to Sandra and Joanne. Welcome.
Thank you, Cindy. If we want to create a world where every child can thrive, it requires that we assure that all children have the kinds of relationships and environments that provide them with safety and with stability and with nurturing. Assuring safe, stable, nurturing relationships and environments for all children is our vision here in the Division of Violence Prevention of what we want for all children. And we know that safety, stability, and nurturing relationships and environments are essential for providing the context and the foundation for healthy development for children in the early years of life. And we know that the early years of life are the time where the foundation for future learning and health is built. And this leads to strong economy down the road, stronger communities, safer communities, and also successful parenting of the next generation. So our Essentials for Childhood framework provides a unifying way to look at all of our child maltreatment work at CDC. The framework identifies several broad strategy or action areas for assuring safe, stable, nurturing relationships and environments. The first one is raising awareness and commitment to support safe, stable, nurturing relationships and environments. And this is not just about doing a media campaign or just about making people more aware that there's a problem, but it's really about building commitment that leads to prevention action. Prevention action around societal factors that are needed in order to prevent child abuse and neglect and assure safe, stable, nurturing relationships and environments. Commitment to developing the kinds of partnerships and public commitment that's needing to reach that goal. The second area is using data to inform our actions, really looking at what kind of data do we have that tells us about the conditions of children and families in our communities and states. Where are the gaps in our data? How do we use this information to come together around a common agenda and common measures toward achieving our vision? And the last two areas are creating the context for healthy children and families, creating the context through norms change, through programs, and through policies. Norms are an area that I think we haven't spent a lot of time thinking about in this field, and certainly it's an area that we're interested in learning more about. Policies. We need to be identifying policies that can support safe, stable, nurturing relationships and environments, and using our data to help inform decision makers so that they make good decisions about strategies and policies. We think it's important to be working in all four of these strategy areas simultaneously if we want to have greater impact and success in assuring safe, stable, nurturing relationships and environments. We're funding 5 state health departments to implement this framework: California, Colorado, Massachusetts, North Carolina, and Washington State. It's been very exciting to have a lot of interest among a number of self-supported states that don't receive CDC funding but are participating in this initiative in some way. And this ranges from Kansas, that has found funding to really try to do everything that the funded states are doing, to other states, around 30 or more states that are working in different areas, from incorporating the essentials language into their work to using the framework for their plans, etc. We've opened up all of our training and technical assistance to the self-supported states as well as to the funded states. The funded states are required to do work in all 4 of those goal areas that we just talked about, with a particular focus on the last 2, on creating the context, and a focus on health equity as part of their work. It's really important that they take the time to explore relationships between social and economic contexts that might place some children and families at risk and lead to inequitable health outcomes. Because we know if we're going to assure that children have safe, stable, nurturing relationships and environments, we have to address those factors and the norms in the environment that can allow child abuse and neglect to occur. They're also required to have certain partners. They have to partner with the Core Injury Program if their state has one, their CBCAP lead agency, one or more of 3 national prevention state organizations, either Prevent Child Abuse America, the Children's Trust Funds, or Parents Anonymous, and many of our states have one or more of these organizations as their co-backbone or lead. They are required to have a business partner and to engage other non-traditional partners, for example, the media. And the last thing that they're required to do is to use a collective impact process. And this is a process that is different in many ways from our typical collaboration. A collective impact process that is implemented in the intended way is one that's more strategic, more structured, and hopefully higher performing toward getting impact than some of our typical collaborations that we've had. Some of the key things that are involved in a collective impact process are common agenda, so bringing partners together to come to agreement on a common agenda and a shared vision for change, shared measures, mutually reinforcing activities. A really important part of this initiative is aligning efforts among different activities that are already going on in a state, and having the willingness to adapt individual activities so that you can coordinate and align around your common agenda. It requires a lot of continuous communication, open communication, building trust, and I think some of our states, or most of our states, would tell you that this is a really important and hard part to keep up with, is maintaining that continuous communication among the different partners. And it has to have backbone support, and that's an organization or a combination of co-organizations that really work on doing the nitty-gritty pieces of bringing people together, managing things, and maintaining that continuous communication. So our states have been very busy working in these areas. They've all developed a landscape assessment, looking at what's happening in their state, where are the gaps, where are their points of alignment, developing usually a pretty high-powered steering committee, and developing and coming to agreement on a common agenda and vision, and then developing work groups to work on coming up with specific strategies as part of that agenda, and identifying particular measures that they will use together. A few quick examples of some of their work and successes. Most of them have brought together a number of different state efforts, including the trust fund, the CBCAP agencies, launch, early childhood initiatives, and they've come together and they've managed to agree on a shared agenda. They've been successful in getting other entities in their state to use the safe, stable, nurturing relationships and environments in their messaging and in their planning. For example, the Essentials group in Colorado had the essential strategies recommended in their Child Fatality Prevention System legislative report and referenced in their Early Childhood Mental Health Strategic Plan. And similar things have happened in all the other states. They've been educating their partners about Essentials for Childhood policies, priorities, and strategies. And that's resulted in some of the partner efforts to advance these strategies in their work. For example, in California, they have a close relationship with their Department of Social Services, and they are now supporting and expanding their prevention thinking and incorporating social determinants of health in their work as well. They've created the work groups, and they're reaching out to business as a prevention partner. Colorado, for example, is working with a number of different business coalitions to have business forums to talk about the importance of safe, stable, nurturing relationships and environments for children. This is going to be very hard for you to read and make sense out of, I understand, but it's just an example of how Washington State has demonstrated where they are and where they're going with their work, their vision, their commitment. They have a number of shared measures from kindergarten readiness to homelessness and housing stability to child abuse and neglect reports, AIDS prevalence, etc. And then they've identified their cross-cutting strategies for change, and these are the areas that they'll be looking at particular strategies to implement. And at the bottom are their principles, which include being bold and innovative, a focus on primary prevention, etc. This gives you a quick example of the different work groups in the state, which can help you see some of the areas they're focusing on. You'll see some common things like data and public awareness, family-friendly workplace, and norms change, policy change among the different work groups in the states. So to help support the work of the states, we've developed a number of different resources in addition to the Essentials for Childhood Framework document. One recently released is a resource for employers, Boost Your Competitive Edge, Actions for a Healthy, Productive Workforce. And this gives examples for both large and small businesses and employers for things that they can do to promote safe, stable, nurturing relationships and environments in their own organization or company, and also at the same time help parents to be able to provide those at home. We've also have several other resources, one on positive community norms, one on raising awareness and commitment. We're hoping to have two more related to working with the media in the near future. And a second resource that many of you may be familiar with that has been recently released is our Child Abuse and Neglect Technical Package. This is for preventing child abuse and neglect. This is a document that has strategies, approaches under each of those strategies, and then evidence around the quality of the data for each of the approaches in preventing violence or its associated risk factors. This technical package really supports the Essentials for Childhood framework because it has a select set of strategies and approaches for creating the context that we think is so important. So it really ties in and gives additional resources related to the third and fourth goals on context with Essentials for Childhood. For example, the strategies that are highlighted in the document are strengthening economic supports to families. And this list starts with the strategies that have the greatest potential for broad public health impact on child abuse and neglect, and goes down to ones that are more focused on individual or selected populations. So first, strengthening economic supports to families. And then it lists particular approaches in that strategy, changing social norms to support parents in positive parenting, providing quality care and education early in life, enhancing parenting skills to promote healthy child development, and intervening to lessen harms and prevent future risks. The technical package also has a section on different sectors and which ones are maybe best positioned to bring support and leadership and resources to advancing the particular strategies. And it also has information on monitoring and evaluation to track progress. So at this point, I am going to turn it over to Joanne to talk a little bit about how we're evaluating our Essentials for Childhood work.
Thank you, Sandra. To evaluate the Essentials for Childhood, we propose this logic model in the funding announcement where we have the inputs, the framework that Sandra just explained to you, the small amount of funding that we gave the funded states, the collective impact approach, the team's expertise, and we expected all this to lead states to coordinate existing and new partnerships, identify strategies, and then we would also be providing some training and technical assistance. In the participation, we saw that the states were able to create the leadership action teams, which some of them have called them steering committees, and then the collective impact team work groups that are actually trying to implement the strategies that the steering committees proposed. As a result, we would expect in the short term increased strategic collaborations, increased use of data. In the medium term, we were hoping to see increased awareness and commitment, increased use of evidence-based practice programs and policies, and in the long term, we want to see a change in narrative that shows that we share the responsibility for children's well-being, a change in norms around acceptable parenting behaviors, an increase in safe, stable, nurturing relationships and environments for children, and a decrease in child maltreatment reports. As you can imagine, this is a very challenging evaluation because both the problem and the intervention are very complex. There are many sectors and organizations involved, and the actions are dependent on the moves or actions of other players. There's also a high degree of uncertainty about what will work, in what kind of context, and with whom. And we know that data and feedback was going to be needed continuously to decide the next steps. So initially we thought that we would be able to do this, but early on we realized that we needed to involve the state evaluators in evaluating what was going on the ground and using what is called developmental evaluation. The developmental evaluation is very focused on interventions and problems that are complex and where there's a high degree of uncertainty of what will work. And so they are able to see what's happening and provide timely feedback to the team. As for CDC, we're looking at this funding as a pilot of the framework. We want to know, is it feasible? How well is it implemented? Does it have an impact? And we want to use the lessons learned to be able to refine the framework. Did we have the right goals? Was the collective impact approach the right approach? We are collecting information on how and how well the collective impact process is implemented, what kinds of strategies emerge, what circumstances or contextual conditions lead to new strategies, implementation or rejection of strategies, what strategies and partnerships lead to change in awareness and commitment in programs, policies, and norms, how the larger system responds to the initiative, and what kinds of barriers, facilitators, and opportunities states encounter and any successes observed and lessons learned. And of course, we want to know whether there was any progress in each of the 4 goal areas. We have multiple data sources for this, and a lot of it is qualitative data. All our conference calls, evaluation conference calls, are recorded, and we have transcriptions and analyze those. We also analyze the yearly reports. We have the state's baseline landscape assessment. We also did a baseline institutional commitment survey, and we'll do that again at the end of the initiative to establish awareness and commitment among the institutions that are participating in the initiative. And we also conducted a baseline public awareness and commitment and community norm survey, and we'll do that again at the end of the initiative. And we did that also at the national level so that we can have a comparison of the funded states and the whole United States. For our long-term goals, of course, we want to be able to show increases in safe, stable, nurturing relationships and environments, and we also want to show decreases in child abuse and neglect. But especially, it's an inequitable burden on low-income families. So you probably all know that about 80% of child maltreatment is child neglect, and child neglect is 7 times more likely in low-income households. And so we needed to think more critically about what we were doing, and one of the things that we did was bring in another framework to help us think of what leads to the inequitable distribution of something like child neglect. So we brought in the World Health Organization's social determinants of health framework, which basically just shows that the inequitable distribution in child maltreatment is due to some intermediary determinants, which are mostly living conditions, but that these living conditions are then caused by some structural determinants that have to do with the social and economic political context that leads to certain groups being into different hierarchies based on their education, occupation, and income. In practical terms, for essentials, we are looking then at this socioeconomic and political context and tracking state laws that are supportive of children and families. Specifically, we're looking at macroeconomic policies like the state earned income tax credit and child tax credit. We're looking at labor market policies like whether living minimum wage is a livable wage and whether there's family-friendly work. We're looking at housing policies like inclusionary zoning to make more greater access to affordable housing. We're looking at child care and education policies like whether there are wait lists for child care, what the coverage is for pre-K, and whether schools are funded fairly. We're looking at social protection policies like eligibility for TANF and the amount of the benefits. And for cultural and societal values, we're looking at whether corporal punishment in school is allowed or banned, and whether children are treated as adults in the justice system. But we know that in order to have changes in these policies, the WHO framework has put this cross-cutting box as the change agent. So we know that when communities are organized, they can change policies. And so we're looking at voter turnout, and we'd love to get some data source around the percent of citizens who are organized. That would give us a better idea of whether we're going to be able to see changes in policies. In the middle box of structural determinants, we're looking at changes in socioeconomic positions, so whether income inequality is reduced, whether racial inequity is reduced, whether the gender wage inequity is reduced, and more specifically around children, childhood poverty, whether there are race and ethnicity differences in reading in the 4th grade. We think that if we're able to change these policies and we're able to change or decrease the differences in the hierarchy that people are grouped into, that we will see changes in neighborhood conditions. So we want to see a decrease in children living in concentrated disadvantage and in children who live in neighborhoods without amenities. We want to see a decrease in children who are food insecure or homeless or live in households in poverty. And there are also some other psychological factors and behaviors that we want to see decreases of, like exposure to partner violence and postpartum depression, And then we want to see an increase in children who are read, sung to, or told stories to daily as part of a safe, stable, nurturing environment. We're looking at some changes in health services, mostly evidence-based programs. So we're looking at whether there's an increase in the coverage or reach of the home visitation program and an increase in the percent of of the community-based child abuse prevention dollars for evidence-based programs. And finally, if all this happens, we should be able to see a decrease in total reports for child maltreatment, in substantiated reports by race, ethnicity, reducing the gap between African Americans and whites, and a decrease in emergency department visits, hospitalizations, and deaths attributed to child maltreatment, and then a decrease also in children who are exposed to 2 or more adverse childhood experiences, and especially the inequitable burden of adverse childhood experiences by race, ethnicity, and by income. And that's all I have for our evaluation, so I'm not sure who I hand it over to next.
I'll take it. Thank you so much, Sandra and Joanne. This is Cindy Rogers again, and I'd like to introduce our next speaker, Leslie Erdelak. Leslie is a senior analyst with ASTO, the Association of State and Territorial Health Officials. Since joining the organization, she has been involved in multiple projects to support ASTO members in improving health outcomes. In her current role, Leslie collaborates with state and national partners in mental health and substance abuse prevention. Leslie?
Great, thanks, and good afternoon, everyone. Thank you again for the very kind introduction. I'm pleased to be here on behalf of our team at ASTO, and I'll be talking today about some work that we are doing to look at how public health and other partners are working in the early childhood policy arena and how we're building on the excellent work of the Essentials for Childhood by identifying some specific policy options and approaches that states can take to create the context for healthy children and families, which you just heard described as goal number 4 under Essentials for Childhood. So my focus here today is to tell you a little bit about ASTO, to speak about the policy guide that we're developing, with the one important caveat that the guide is not yet available. It's still a bit of a work in progress, so we don't have a tangible resource to share with you, although the goal is to have it ready sometime this summer. But what I hope to do today is to still give you a sense of the kinds of policy approaches that we cover in the guide and offer a few state examples that we've come across in developing this resource that I hope might be useful to you in your work. So a few words about our organization. The Association of State and Territorial Health Officials has 59 members. That's 1 appointed state health commissioner in each of the 50 states and D.C., plus 5 U.S. territories and 3 freely associated states. In addition to serving these 59 state and territorial health officials, ASTO supports other state health agency staff, and we like to say that we're always ready to help each agency in whatever capacity we can, and we're really fortunate, I think, to have a high level of involvement and leadership from our members, and they really play an important role in helping provide the strategic direction for the organization's work. ASTO supports its members on a pretty wide range of topics based on their needs. We've worked on health equity, we've worked on integrating public health and clinical care, emergency response, environmental health, and of course, injury prevention and behavioral health. We also have a wonderful state health policy team that tracks legislative activity at the state level and provides research and technical assistance to help health departments and other partners understand national trends and emerging issues in public health. And then finally, given that one of the central themes of my presentation today is about what states can do with other partners, where would we be without our tremendous partners across the governmental, private, and nonprofit sectors helping us carry out our mission to transform public health within states and territories to achieve better health and wellness. So as Sandra said so beautifully at the beginning, there's been a lot of research to show exactly how early trauma really can last a lifetime and how it really shapes the way that children and adults learn, play, and grow. Trauma from abuse and neglect and adverse childhood events affect everyone, if not personally, then through relationships, schools, workplaces, and the larger social context that we all share. But beyond just the individual parent-child relationship, we have to look at what's happening in the communities where people live. And when we think about preventing adverse events from happening in early childhood, that interplay between community and environmental factors is really important and includes the availability of services, things like wages and income, workplace, and public policies and social norms. And that's really, to me, what the third and fourth goals in the Essentials for Childhood framework are all about. And as I mentioned, we've got some exciting work underway to shed some light on specific approaches that address multiple risk factors for child abuse and neglect at the policy and systems level. So really focusing in on goal number 4. And our policy guide really does outline options that state agencies can consider to create the context for healthy children and families. So in developing this resource, our goal was really to provide a menu of policy strategies that reflect the best available evidence for what works to promote safe, stable, and nurturing relationships and environments, given what we know about some of the overlapping risk and protective factors for child abuse and neglect and other forms of violence. We also recognize that a wide range of policies are really important for promoting children's health, especially policies to prevent child abuse and neglect from happening in the first place. So very briefly here, the strategies that we discuss fall into the following categories that are listed on the slide. So under economic and social supports for families, we know that poverty makes it harder for parents to meet their children's most basic needs, and not surprisingly, it creates significant stress. The adverse health effects of low family income also accumulate over time, and children from poorer families often enter adulthood with worse overall health. So it's really important to think about longer-term outcomes, too, when we're talking about policies intended to support stable and economically secure families. Under quality care and education early in life, policies that promote access to affordable child care allow parents to work and support a family. Quality child care also introduces children to nurturing relationships and stimulating learning opportunities. For supporting parents and positive parenting, these are the types of policies that provide employees with the flexibility to spend some time away from work, whether they're caring for a child or another family member, really without the worry of losing their jobs or income. And these types of policies encourage stronger family bonds as well as increased productivity when employees return to work. So I think in the interest of time, I'm going to skip over this slide, but we do know that early experiences, especially within the first 3 years of life, really do transform the architecture of the brain. And the policy options that we're talking about were selected based on the best available evidence, number 1, and number 2, because I think it's reasonable for us to believe that they'll have a really positive impact on the first years of a child's life. So for each policy option that we describe in the guide, we also wanted to be able to provide examples to show how these policies are playing out at the state and local levels, whether they were organizational, regulatory, or legislative in nature. But then came the question, so what is the role of the state health department, and recognizing that leadership and commitment from other sectors is important too. What is the role of other state agencies and partners, and how are we seeing this play out in states? And what can we point to as a model for collaboration? So one example that we came across was Connecticut's two-generational initiative. Last year, in 2015, Connecticut passed a provision in the state budget creating a two-generational school readiness and workforce development pilot program. By delivering early education and workforce services that touch multiple generations of a family at the same time, the goal is to promote economic self-sufficiency among low-income families. So there are 6 pilot communities that put forward proposals actually just earlier this year, and they all contain strategies for linking and promoting child care, early childhood and adult education, mental health, housing, literacy, transportation, and workforce development. One proposal stated needing to really change that mindset from emergency or individual service delivery, changing that mindset into one that's more holistic and coordinated. So what's beginning to happen is that state and local governments are working together to align funding, programming, and other systems so that community-based programs can more easily provide these and other types of two-generation services. To oversee the legislation, or to oversee the program rather, the legislation established an interagency work group that's co-chaired by 2 leaders representing the Appropriations and the Human Services Committees, and it's managed by the Connecticut Commission on Children. The interagency work group is comprised of commissioners from the Departments of Social Services, Early Childhood, Education, Housing, Transportation, Public Health, Labor, and Corrections. Also represented on the work group is the Chief Court Administrator, nonprofit and philanthropic organizations, and other business and academic professionals. So you can read the community proposals and learn more on the Connecticut Commission on Children's website. The next 3 slides that I'm going to show you are really just intended to give you an idea of the menu and the range of policy options that we discuss in the guide. All of the policies that we cover have been shown to impact risk factors for child abuse and neglect directly, or by impacting behaviors related to abuse and neglect. And so I'll just put in another plug. If you are looking for a comprehensive review of the evidence that cites specific studies and findings from the literature, I'd encourage you to check out CDC's Preventing Child Abuse and Neglect technical package that came out last month and that Sandra described. I think it's a terrific resource, and we see a lot of complementarity between the technical package that describes the evidence base and the policy guide that we're working on that explores in greater depth the role of state health departments and other partners. State and local agencies often have access to the best available evidence that can guide public policy. But with that being said, we recognize that these policies haven't always been viewed favorably by state legislatures and other policymakers, which I think points to a continued need to identify successful approaches and document what is being learned about the impact of these policies and the impact that they're having not only on state budgets, but on families. So under the topic of family economic and social supports, we discussed tax credits for families with children, increasing compensation, particularly for low-wage workers, subsidized housing and the use of housing vouchers, and ways to simplify or streamline the enrollment procedures for nutrition assistance programs like SNAP. So what I will say regarding increases to the minimum wage, and this is just For example, even though, we've heard that at least for now, this proposal might very well be off the table for some states. So what we're, suggesting instead, and what we're saying is that public health can still have a meaningful discussion with policymakers around this issue by exploring the feasibility of other measures that are complementary to something like raising the minimum wage, measures that might also benefit low-wage workers, like policies to ensure paid sick time, more consistent scheduling, and protections against wage theft. So the types of policies discussed here under quality care and education early in life might include those that touch on early childhood programs and systems, including pre-kindergarten, Head Start or early Head Start, access to high-quality child care, and home visiting. And there's an example from North Carolina on this slide where the Division of Social Services, Economic and Family Services, which is the agency that administers the temporary assistance for needy families or TANF benefits to families, partnered with the North Carolina Head Start State Office in an effort to improve coordination between Head Start and Early Head Start and families receiving TANF benefits. And the two state agencies use a portion of the state's Head Start funds to create a competitive grant that was designed to get local Head Start and Early Head Start programs and their county social services offices working together to increase cross-agency referrals, to bring together staff who had similar job functions from both programs for training and professional development, and making sure that for families that are served by both programs, that both agencies were really involved in helping families set its goals. So both programs, through this effort, were able to bring their collective resources to the family, making for a more focused effort. And finally, we discussed policy decisions that state agencies and businesses in particular can take on so that adults can succeed in their role as parents, policies like paid leave, which might encompass family, parental, and medical leave. And I'm glad to know that we have Dr. Clevens on the line with us today, and she can certainly speak to this in greater detail, but I wanted to call your attention to a study that looked at the association between California's paid family leave policy and hospital admissions for cases of pediatric abusive head trauma. And one of the many interesting things about this study, and it did find that paid leave was associated with a decrease in abusive head trauma admissions, but it also raised an interesting point around health equity, which, as we heard earlier, is an important component of the Essentials for Childhood work and integral, I think, and many would agree, to public health overall. Nationally, we know that there are large disparities in access to paid leave, with the most disadvantaged groups often having the greatest unmet needs for paid leave. And in the California example, in the study, when it was published, only a small number of eligible parents took advantage of the paid family leave policy, and there was little awareness of the program, especially among low-income workers. So it begs the question of, could this differential access to paid family leave be contributing to the inequitable burden of abusive head trauma, particularly in communities that are disproportionately represented in child welfare and other child-serving systems? So in closing, I have just a couple of final remarks. Research shows that the domains of childhood and child development are really interconnected, and states can, and many are already, integrating what is known about the health impacts of early childhood experiences into more cross-cutting types of policy efforts to encourage better linkages across sectors and really address health and developmental needs of young children. We're really excited to leverage and build on the work of CDC's Essentials for Childhood by helping state health departments and their partners understand, communicate, and implement policies that support healthy families and communities. And we really look forward to sharing ASTO's forthcoming policy guide with those of you participating today. And again, we hope that you and your partners find it useful in your efforts. So thank you very much. I'll wrap up here. I want to say thank you for giving me some of your time this afternoon to talk about our work, and I'll turn it back to our moderators.
Great. Thank you so much, Leslie, and again, Sandra and Joanne. It's now time to open the floor for questions. If you have a question for any of our presenters, please go ahead and type it into the box at the bottom left of your screen, and I'll read the questions as they come in. But Leslie, first question is for you. Regarding the guide, how can people access that, or how can they stay posted on when it's going to be actually released?
So we are currently working on a dissemination plan for the guide. As I said, we hope it's going to be released sometime over the summer, and we can work closely, and we have worked closely with Children's Safety Network in the past, to keep each other up to speed on resources that are coming out. So I will certainly keep you in the loop. We can also just keep an eye out. I think ASTA will be doing some webinars, and we have some other ideas around venues to really promote the guide. If you want to share your contact information with me, I'd be happy to send you a note or add you to one of our listservs so that you can find out and be aware of when the guide comes out.
Great. Okay. We're all looking forward to it. So thank you, Leslie. So we've got some great questions from our participants, and I'll read the next question, which is, how can screening parents for a history of ACEs help with preventing child abuse? Now, I don't know which of you would like to take that on, but perhaps you would just start with a very brief explanation of what ACEs is for those people who are not familiar with it.
This is Joanne Clevens. I'll take that question. Adverse childhood experiences, as they were measured originally in the study that CDC did with Kaiser, had 10 different experiences. 5 of those had to do with child maltreatment, so there were physical abuse, emotional abuse, and sexual abuse, and then physical neglect and emotional neglect. Another one had to do with witnessing partner violence. Another had to do with living in a household where there was a person with mental health issues or substance abuse, or a person in the household had been incarcerated. And I think the final one was parental divorce or abandonment. In that original study, they found that as people had experienced more of these adverse childhood experiences, the probability of experiencing adverse health outcomes increased. And it had to do with not only risky behaviors, but also chronic diseases, infectious diseases, and, of course, risk of violence. Up to now, although some organizations are recommending that we screen parents for adverse childhood experiences, up to now we don't really have any evidence that would work. It seems common sense that if we screen parents for adverse childhood experiences and provided an effective intervention, and we know there are effective interventions, and we know there are accurate screening tools, that we would see decreases in child abuse and neglect. But we don't have evidence from any kind of rigorous evaluation of that.
Great. Okay. Thank you. Thank you very much, Joanne, for that answer. Another question, and this is pretty broad, but I'll read the question as it's stated, is do you have any advice for professionals working in school settings on this topic? So Are there any specific resources that you would like to direct to this person, or some suggestions?
Joanne again. I'm thinking that one of the things that schools might want to learn about is the consequences of being exposed to adverse childhood experiences, because it increases the likelihood that children will have behavior problems in school. And because the response in the past has often been in either suspending or expelling children, we practically root these children onto additional problems down the line. And so as schools become trauma-informed and understanding that when children act out in school, they're disruptive, inattentive, that this could be because of adverse childhood experiences, then teachers and school staff in general are more responsive to that kind of behavior and can handle it in a better way than just excluding the child from the classroom. So in that direction, for example, California recently passed, after the health department educated the legislature around adverse childhood experiences and some of the consequences in problem behaviors, the legislature decided to ban the suspension and expulsion of young children from pre-K to grade 3. I think Connecticut has also done something similar. And there's another school in Washington State that has also taken that up to children in middle and high school, so that just being trauma-informed and trauma-responsive can lead to changing school policies around discipline.
And another thing to think about, this is Sandra, in terms of schools. Schools are employers. They employ staff in many different areas, teachers and other staff. And for the schools, as they look at their policies and procedures, to keep in mind things that they can do to be supportive of their staff in terms of having environments that are safe and stable and nurturing, so that it makes it easier for their staff to provide that to students who may need a little extra dose of it in the school setting if they're not getting it in the home setting.
Great. Thank you both for those responses. Another question is looking for some suggestions about working on abusive head trauma at the community level. Do you have any suggestions for effective prevention programs regarding this?
This is Joanne. We recently completed 2 statewide trials evaluating educating new parents in maternity wards around infant crying and the dangers of shaking infants, and providing some alternatives to what to do with an infant crying. And unfortunately, neither intervention, we evaluated PURPLE, which some of you may be familiar with, in North Carolina, and evaluated Mark Diaz's model in Pennsylvania. That his model had originally shown some promising decreases in abusive head trauma when he did it in upstate New York, but in replicating it in Pennsylvania, it did not show an impact, and PURPLE didn't show an impact in North Carolina either. So we were pretty discouraged with those findings. It may be that it was too soon to evaluate PURPLE. They really had only 1 or 2 years of data post-intervention, and so maybe if we had waited a little bit more, we might have seen an impact down the line, but the immediate impact was not evident in the data that we had. We think that probably education is not going to be sufficient in preventing abusive head trauma, especially for individuals who have maybe experienced trauma in their lives and have issues with managing frustration and anger, and that there may be other ways of preventing abusive head trauma, and that's why we thought it was so promising to see that paid maternity leave had impacts on abusive head trauma. And the reason we thought that it could have had an impact was because the main perpetrators of abusive head trauma are male caregivers. And if women don't have to leave their babies with their male partner, boyfriend, or whoever to have to go back to work, then maybe that would be the reason why paid maternity leave was preventing abuse of head trauma. So we think that would be a promising direction to go.
Another thought, this is Sandra, it may be, and I'm not speaking from any particular research at the moment about this, but it may be that paying equal attention to teaching children early on, and then even older children and adults, skills around anger management and empathy and impulse control may have as much to do with preventing shaken baby as some other things, or at least in combination of the educational strategies that are being used.
Great. Thank you again. Thanks again to both of you for responding to that question. I just want to let everybody know that we've added a link to the technical package, which Sandra mentioned earlier in the presentation. We've added it since she mentioned it, so you might want to take a look at that. It's a terrific resource and a very new resource. So another question is regarding community assessment tools. So the question reads, with any work done, was there a community assessment tool used? Or if a community wanted to address this problem, what community assessment tool would you recommend, if any? Any thoughts about that?
Hi, this is Leslie, and I'd be happy to take this question. It's actually really timely. I recently came across a tool, and Cindy, I can share it with you maybe to send out to participants, but it's called the Roadmap to Resilience Community Assessment Tool, and it was developed by the Baltimore Thriving Communities Collaborative. And I came across it. If you're not familiar, there's a great website called ACES, www.acesconnection.org. Lots of similar tools have been posted, but I would be happy to share this one along if it might be useful. Again, it's called the Roadmap to Resilience Community Assessment Tool, and it's a product of Baltimore.
Excellent.
I'm sure it's one of many, but I thought it was a really, really great example.
Great. Thank you, Leslie. We will take a look at that and we'll share it with the audience. Thank you. Let's see. Here's again another broad question, which I think any of you can answer, which is someone's looking for suggestions of best actions for nonprofit organizations to take in helping raise public awareness and help with preventing child abuse. Any thoughts?
So one of the things, this is Sandra, one of the things that we've been learning in the work that we're doing through Essentials for Childhood and working with the states and working with framing and communication experts is one thing that we can all do is to stop and think about how we're communicating about preventing child abuse and neglect, how we are framing the narrative and the issue, and pay particular attention to really not starting with the problem so much so that people don't default to it's bad parents and bad parenting or the children aren't doing what they need to do, but really start with common values or visions and focus on why it's important that children have safe, stable, nurturing relationships and environments. So it's not ignoring the problem, but not just focusing on the problem, but a both and.
Great. That's very useful information. Thank you. We only have 1 minute left, and I wonder if one of you could just very quickly talk a little bit about the film. I believe it's called Raising of America. Sandra or Joanne?
Yep. This is Joanne. The Raising of America is a documentary series produced by California Newsreel. Many of you may be familiar with some of their previous productions. They did Unnatural Causes and Race, the Power of an Illusion. In this one, The Raising of America, what they are trying to do is address what we are calling raising awareness and commitment, and that is changing the understanding of what leads to successful children and trying to have a shared commitment around what we can do for children and make sure that all children thrive. And so they connect the success of children to the prosperity of our nation. And that's the shared value that they're proposing, that if we invest in our children, and they suggest some policies like paid maternity leave and high-quality child care and high-quality pre-K, but in general, just being supportive of children and families so that parents aren't stressed. They talk a lot about the effects of parental stress on children and child development, we'll try to change the conversation around what we can all do for children and make sure that all children thrive. The series is 1 hour long. The main documentary is 1 hour long, but it also comes with 5 modules that are shorter that kind of serve as discussion tools. So one of them is around the economic case for investing in our children. Another one is around how we almost had universal high-quality child care, but it didn't make it through. Another one is around trauma and how children in neighborhoods that are just overwhelmed with violence and how that has effects on children. And then there's another one on epigenetics and how trauma can get into the physiology and how they describe it, how trauma gets under your skin.
Got it. Thank you so much, Joanne. So I just want to make sure our audience knows that we've added links over to the left of your screen to Raising of America and also the information from Baltimore. So unfortunately, we have come to a close of today's webinar. I want to thank our presenters, Sandra Alexander and Joanne Clevens of the CDC, and Leslie Erdelak of ASTO for their incredible presentations. And finally, we have an evaluation of today's session. It will only take you a moment, and I hope you'll take that moment to complete this. So thank you to all of our speakers and to all of you, our participants, for joining us in today's webinar. Have a great rest of the day. Bye-bye.